It is early morning in Chisi Island in the middle of Lake Chilwa. Docked at the shore is an emergency boat. On board, Nurse Dickens prepares to take the first patient of the day to a hospital on the other side of the lake. Locals call this the boat of life. It transports patients who need emergency care on the mainland. The boat was founded and funded by UNICEF. As well as a trained nurse, there's safety gear and medical supplies on board. But just a few years ago, this journey looked very different. While the boat takes just 20 minutes to get to the mainland, the only option before was to take a 2-hour journey by wooden canoe. Mary remembers that time all too well.
My labor pain started in the middle of the night. Because it was dark, we had to wait until morning. We left the house at 4 a.m., arrived after 6. We paddled for hours, but by the time we arrived, it was too late. The baby was weak and she died.
Mary is just one of the 6,000 residents on Chisi, many of whom have been forced to gamble with time and tide in moments of medical emergency.
I was devastated by what I went through. From the moment the labor pain started to when we reached the hospital, I was in so much pain. There was no hospital here on the island back then. We had to go all the way to Likanga, but there was nothing I could do.
There is a small clinic on the island, but it isn't equipped to deal with emergencies. Now, it can triage cases for the boat trip to the mainland. In Malawi, 83% of the population lives in rural areas, with the nearest clinic an average of 8 kilometers away on land.
Before, we had a lot of maternal deaths. We had a lot of people that were neglected, like the implementation of the HIV services. It was difficult to bring the supplies there, and also for health workers to access the people.
But challenges remain. There's only one boat on an island with 5 separate villages and a growing population. Fuel shortages and maintenance costs also pose constant risks. And although the boat has changed lives on Chisi, its residents say they want the government to make healthcare a higher priority for hard-to-reach communities like theirs. Okumu, BBC, Malawi.